68 DST 105 Sterile Duties of the Surgical Technologist Exam Review rated A+. Antimicrobial heavy checkmark chemical or pharmaceutical agent that destroys or inhibits growth of microorganisms. Residual heavy checkmark leaves an antimicrobial residue on the skin to temporarily prevent growth of microorganisms. Mechanical washing heavy checkmark process which removes soil and transient organisms with friction by use of mechanical means/equipment as opposed to manual. Transient organisms, usually loosely attached to skin surface and almost completely removed by thoroughly washing with soap or detergent and water. Chemical washing AOE, the process that reduces resident flora and inactivates microorganisms with an antimicrobial or antiseptic chemical agent, may be acquired through a rapid bactericidal action waterless one-step process such as Avogard. Resident organisms resides below the surface of the skin. 1/4. More adherent, therefore more resistant to removal. Their normal growth is inhibited by chemical phase of surgical scrub. Subungual under the fingernail. Palma bottom. Dorsal the back of the hand. Grossly soiled contaminant is visible with the eyes. Surgical hand scrub the process of removing as many microorganisms as possible from the hands and arms to render them surgically clean. 2 methods. Timed and counted method. Timed surgical scrub technique a prescribed amount of time is allotted for each designated plane of the hand and arms. 2/4. Counted brush stroke method a set number of strokes are allotted for each designated plane of the hands and arms. We should be shooting for 12 minutes. List the objectives of the surgical hand scrub A11. Decrease the number of resident and transient microorganisms on the skin to a minimum. 2. Keep the population of microorganisms to a minimum during a surgical procedure by suppression of growth. 3. Reduce the hazard of microbial contamination of surgical wounds by skin flora. List the requirements used for selecting antimicrobial scrubbing agents. Heavy checkmark broad spectrum. Antimicrobial. Fast-acting and effective. Non-irritating and non-sensitizing. Habicines. Prolong-acting. Leave residue on skin. 3/4. Independent non-cumulative. Does not require adding other substance to achieve goal. State the requirements the surgical technologist must meet prior to beginning the surgical hand scrub. Good health heavy checkmark, no colds, upper respiratory infection, URI, or contagious diseases. No cuts, abrasions, lesions, or skin disorders on hands and forearms. State the requirements the surgical technologist must meet prior to beginning the surgical hand scrub. Appropriate surgical attire heavy checkmark review lesson 2.4 personal hygiene and/or attire. Hair cover and mask. Appropriate eye protection. Shoes designated for the or shoe covers. All jewelry, including watches, removed. Powered by TCPDF www.tcpdf.org. 4/4.